that we post there all the time, and before and after pictures. You can start the consultation process, so go check out our website, pureplasticsurgery.com. I'm Dr. Garrett Wegerif. I am a double board certified plastic and reconstructive surgeon. Today we are going to be talking about a great subject, which is fat grafting to the breast. This is one of the other tools we have in our toolbox to provide really natural, beautiful results for your breast using your own breast tissue. So we have some common questions that we get here I'm going to be going over. If anybody else has some burning questions, write it down in the chat and I'll do my best to get to everybody. All right, is fat transfer to the breast the right option for me if I want natural looking results but don't want implants? And yeah, that's really one of the main advantages of fat grafting to the breast. Fat grafting to the breast is really good at restoring volume. So if you've had a few children and your breasts are just a little deflated compared to what they were in your youth, fat grafting is a great option. It's always going to be a more natural look than what an implant can provide, because the structure that fat has is never as structured as what an implant is. So especially for restoring the upper pole volume up here, an implant's probably a little bit better for that very defined upper pole cleavage, but fat grafting is a great option for people just wanting to restore their overall volume and get a nice natural look. Plus it's using your own tissue, so it's not something that ever needs to be removed or replaced in the future, which is something we need to consider with breast implants. So it's a great option for that. How does fat transfer to the breast work, and what can I expect from the procedure in terms of results? So how it works is we need to get fat from somewhere else. So we need to do liposuction to some part of your body. So typically it's around the abdomen or flanks, but we can even do the inner thighs, the arms. There's a lot of different areas where we can grab some fat to transfer to the breast. We clean the fat off, put some antibiotics in it, and then I very carefully inject it into the right planes of the breast to restore that volume. So there are some limitations when we talk a lot about fat grafting to the butt. That's what that's what a BBL is. And typically when we graft fat to the butt, we can expect about 65 to 70% of that fat to survive long term, as long as you're abiding by the post-operative instructions and not putting weight on your bottom. For the breast, for whatever reason, I think it's likely due to the blood supply in the breast, we only expect about 50% long-term survival rate of the fat. So this oftentimes means that we need to do more than one grafting to get the optimal results, because there's also a limit to how much we can transfer at one time. Again, because the breast has a little less blood supply than the butt, it needs to reestablish that blood supply to the fat that we graft. So really, it's about 150 to 200 cc's of fat that we can transfer to the breast at any one time, and then of that, about 50% survives. So sometimes we need to do this more than once to get the optimal result you're looking for. And then what kind of women are ideal candidates for fat transfer to the breast? Do I need to have a certain body type? Well, the big thing we think about with this is the same things we think about for anyone wanting a breast augmentation. Do you have drooping of the breast or ptosis of the breast that requires a lift to improve the shape of the breast before restoring the volume? So if your nipple is above your fold, and you just have depleted volume, you're a great candidate for this procedure. You also need to have areas for donor fat. So if you're super lean and you have very little, if you're a bodybuilder type or a fitness model type, you might not have a lot of fat for us to go after to get. And so that's something else we need to consider to be the right body type for this procedure, because we need to get the fat from a donor site and be able to transfer it. And then how much fat can actually be transferred to the breast, and is there a limit? So there's not technically a limit of how much can be, by any type of rules or regulations in the state of Florida about how much can be transferred. But we want to think about what can be done safely without the risk of causing something that we call fat necrosis, or where, if we were to inject a large amount of fat that wasn't able to reestablish a blood supply, it could result in fat necrosis, meaning that fat doesn't survive and it could even form a cyst or something that needs to be drained in the future. So that amount is, I never really do more than 200 cc's per breast per episode of fat grafting. And then, can fat transfer be combined with other procedures? So yeah, it absolutely can be combined with other procedures. You know, if we're doing a tummy tuck or something like that, this can be mommy makeover style procedure. Can even be combined with other breast procedures. So, or some women that have existing implants and they just don't like how the shape of the implants is very prominent. Fat grafting is a great adjunct to soften the outline of the implant, because we can inject around in the upper pole or even the medial pole where there's limits. We can only bring the implant so far to the medial aspect because they're typically underneath the muscle, or we don't want to cause some mastia. So fat grafting can be a great adjunct to augmentation to give some extra fullness to the medial part of the breast, to really give that cleavage that a lot of people are looking for, especially that closer cleavage. So yeah, it is definitely possible to combine with other procedures. It's a great adjunct. What happens to the fat once it's transferred to the breast? Does it stay permanently, or is it absorbed over time? And so like we said, during those first few months, yes, some of it is absorbed, about 50%, but after that, it does stay there forever. Now, can it fluctuate with weight fluctuations? Yes, absolutely. And that's something we talk about with any type of fat grafting, especially for like BBLs. If you gain or lose a significant amount of weight, that'll change the area that the fat has been grafted to. One of the other things we just need to think about and have a frank discussion about is whenever we're transferring something to the breast, you know, obviously a big concern for any breast procedure is the possibility for being able to identify breast cancers in the future, because that's always a major concern. We want you to be able to get the proper screening to rule out breast cancer in the future. And there's having fat grafted to the breast may result in increased number of biopsies over your lifetime, even though there's a lot of evidence now supporting that anything like microcalcifications from fat grafting is well identified by a skilled radiologist, still may result in some additional imaging of the breast. But again, the trade-off is you're using your own tissue. There's not anything like capsular contracture we have to worry about. You don't have to worry about exchanging or removing them in the future like you have to think about with breast implants. It gives you that very natural result if that's what you're looking for. So it's a great option for the right patient, and definitely something you need to speak to your plastic surgeon about and have a full consultation to see what is the best option for you. So with all that information being said, do we have any questions from the audience right now?
Yes. Let's start here in pure plastic surgery. Is normal after 5 months of the BBL feel a little weird when I'm in bed sleeping, like body awakening, or like something is new in my body?
That's definitely possible to have some type of a change still at the 5-month mark. You know, when I think about any of the surgeries we do, it really takes our body, you know, most of the result you're going to get within the first few months, and most of the recovery is going to be done within the first 3 months. But it really takes up to a full year for you to completely recover from just about all the procedures we do, especially for things like liposuction or tummy tucks, where we're irritating some nerves sometimes when we do that. And so people and nerves take a very long time to recover completely. Not that we're, you know, harming them significantly, but they can be irritated, and it can take months for them to fully recover to the point where you're not having these little zaps or zings that can happen with nerve discomfort. So that's normal to have some feelings of you know, feeling a little off at the 5-month mark after a BBL.
Okay, you're on TikTok. Can you talk about the difference between plastic and cosmetic surgeons?
Yes. So plastic surgeons can practice cosmetic surgery, which is what I am. I'm a board certified plastic surgeon by the American Board of Medical Specialties. And so this is the most comprehensive board. This is where the internal medicine doctors, the general surgeons, vascular surgeons, all the different real medical boards that are recognized by Medicare, Medicaid in the United States. I am one of those plastic surgeons. A cosmetic surgeon is typically someone who did training in something like general surgery, OBGYN, even stranger things like dermatology. They do a 1 year, dentist. Like, it's kind of crazy who can become a cosmetic surgeon, and they are board certified by the whatever board of cosmetic surgery, but it's not recognized by all the other boards. So, that being said, I know there's some very skilled cosmetic surgeons out there, but you need to be extremely cautious when you're choosing someone that is a cosmetic surgeon to do your surgery, because they truthfully don't have the same amount of training that plastic surgeons that are board certified plastic surgeons have. So I did general surgery before I did plastic surgery. I have 2 board certifications. I'm board certified in general surgery and by the American Board of Plastic Surgery, which is the true plastic surgery board that's really recognized by everybody.
I love my results, Dr. Wegerif. 2 weeks out, and I'm loving it.
I'm loving that for you. I'm so happy for you. Can't wait to see some more follow-up pictures or see you back in the clinic soon.
Well, I got a BBL, and after a month, I have an infection. I get an abscess, and I lost a lot of my butt fat. Can I get a BBL round 2?
Yes, that is possible to get around to BBL. We really want to identify what caused that issue the first time. Some people are colonized with bacteria, and there's a very rare form of bacteria that can do these smoldering, lingering infections. So the big thing is we want to make sure you're completely clear of anything. You don't have any ongoing infections or draining, but that's definitely something we'll be happy to talk to you about, and it is definitely a possibility to get a round 2 BBL. All right, everybody, thank you for tuning in. Again, Dr. Garrett Wegerif here at Pure Plastic Surgery in Miami, Florida. Come check us out at pureplasticsurgery.com. Have a great day. I will see you next week.
Thank you, Doug. Thank you. Boom, boom, boom.